Well, the United States government remains shut down, and the fight seems to be over one thing: subsidizing Obamacare. Now, let's take you back, if you will, to the year 2013 when the Democrats, well, they controlled the Congress, they controlled the presidency, well, they controlled everything. They decided they wanted to put on the Affordable Health Care Act, better known as Obamacare. Now, remember, we didn't know what was in it. Nancy Pelosi stood in front of a national audience and said, well, we don't know what's in it until we pass it. And once it was passed, Americans were told, here's what you're going to have to do, whether you like it or not. You're going to have to declare on your income tax what your health care is, where you're getting it, who you're getting it from, that kind of stuff, because everybody was required to have health care. And you had to declare it or suffer a severe penalty. Well, the people without health care, they said you have to go on the exchanges that they had set up on the internet, and you would pick out the health care program that you wanted. And they said the cool thing about this new health care program is if you have pre-existing conditions, you would be covered. You couldn't be excluded by the companies. Like they used to do, you're included. And there wouldn't be a cap on this stuff. And there was a number of things that they took care of that was a problem for a lot of folks. And they said, okay, let's get this thing taken care of. And people would have to buy their health insurance. Well, a number of folks decided, okay, we'll go on to the health networks that were offered, and we will buy the insurance. Well, turns out they found out the insurance wasn't cheap. Insurance was going up. But here's the little thing I want you to take a look at, and it's on your screen. You can take a look at. These are the values of the health insurance company's stock, what you and I would pay for them if we wanted to get into some of their stock. The various companies, and the numbers show you what it was in 2010. I'm going back to 2010, and what they are in 2025 for the value of the same share of stock. Keep that in mind. So if you go to United Healthcare, back in 2010 was worth about $26 a share. Today, $328 a share. Yes, it went up 1,177%. Really. Cigna was $32. Now it's up to $295. It went up 822%. And then you have Anthem. That was a $61.90 back in the old days, and now $318. And of course, Humana was $47.46. Now it's up to $280 almost. One share of stock, and that means it's gone up, well, almost 500%. And then, well, you want to go into Molina, $15.38 in the old days, $146, $147 today, and Centennial was $580, $552, now $38, and finally, Aetna was at $30.50 and is now $212. Same share of stock. Back in 2010, 15 years later, 2025. Now, why has it gone up so much? Well, because the Congress realized that the cost of this insurance, there was going to cost some 25 million people who had to buy in to Obamacare on the health network. It's not all of America. It's roughly 25 million people had to buy into this. So they said, okay, we're going to come up with a subsidy, and we're going to help pay for your insurance policy. Now, unfortunately, that money was authorized by Congress, and they were paying in subsidies, but they were paying the money directly to the insurance companies. So the insurance companies were just getting a check from the government. And it was, millions upon hundreds of millions of dollars. And a lot of money. Well, then COVID hit back in 2020. And so many more people got on Obamacare. And what they did in the Congress was they extended out what you could get on the Obama healthcare program and how much your income was. Back when it first started, you had a total family income of around $150,000 to qualify to get on the Obamacare program. Well, now it's almost unlimited. Whatever your family income is, you got a family income of, say, $250,000 a year, you could be on Obamacare. You could get that, and the government is going to pay to subsidize your insurance. So, where's the stalemate now in Congress? Well, back when the government, back when Congress, back in 2020 during COVID, they put a 5-year window on subsidizing. They said the subsidizing would end in December of 2025. And isn't that amazing? That's coming up. So, in the Congress going on right now on the funding that the government has to approve, the Congress wanted to have a continuing resolutions, which means we keep things the same as it was in the past, and we just finance it for another 6, 7 weeks, 8 weeks, whatever it happens to be. Well, the Democrats said, no, we're not going to do that because there's something we want. Well, they had a whole list of things, and I mean a list of things. But the biggest on the list was they wanted to extend out the subsidies like permanently, like forever. And Republicans said, we can negotiate that when we come back, when the government opens back up again, we'll negotiate with you about these subsidies and what we should do with it. And the Democrats said, no, we're not coming back until you give us the subsidies, which is roughly $1.2 trillion. You heard me? $1.2 trillion. So Republicans said no. So now the impasse stays in. But here's something the president has just said to America. And pay attention, folks. He says, that money Congress is sending directly to the insurance companies? Let's send the money to the people whose insurance that we're writing the subsidies on. We're going to send you a check. Here's your check. Now, you go out and find the right healthcare company that works for you. Here's the dollars in an HSA, a health savings account. So you'll have a health savings account. You can use that to get your insurance. But that money would be going to you, not the insurance companies. Because right now the insurance companies are, well, heaven knows what they're doing with that money. You can see right now what their policies are now worth since they've been getting these subsidies. You're throwing money. And by the way, many of these insurance policies that people are getting, you got to have deductible of $10,000 in many cases before the insurance even applies. $10,000 worth of expenses? Like a lot of people couldn't even afford that. But so policies being paid, nothing's being paid out, everything's being paid in, the insurance companies get richer. Now, what do the insurance companies do with that money to ensure that they keep getting the money? Well, they could be contributing to senators or congressmen's political campaigns. Oh, Congressman, here's a donation of $250,000 to your campaign. Trouble is, all that money ends up somewhere. And why do congressmen and senators go in poor when they go into Congress and come out multimillionaires? I might explain to you somehow how it happens. But the insurance companies now are worth gazillions compared to what they were worth back in 2010. And now the president says, instead of sending that money directly to those insurance companies, let's send it to the people and give it to the people who are getting the insurance and let them decide where they want to go and negotiate with each insurance company. Would that bring down insurance rates? Would that keep the subsidies going? I don't know. Frankly, I think the subsidies don't need to be there, and I think the Congress needs to get back there, knock Obamacare out, get rid of it totally, and start with something different that actually works. Because what the Democrats passed in 2013 doesn't work, and that's why they have the subsidies. They realize it doesn't work, and they want the American taxpayer, that's you and me, who may not be on Obamacare. We may have our own insurance policies, most of us do, but we're paying for somebody else. Your taxpayer is paying for roughly 25 million people that have Obamacare, and they couldn't afford it, so the government's helping to pay for it. So now you know what's going on in government. That's the problem. The government is paying for health insurance. They knew that wasn't a good plan. Hopefully this will all get itself worked out, and hopefully the Congress will come back. But right now, you understand what's going on and the money involved, and it's your money. Keep it in your pocket, or else keep Congress from spending it. Either way, it can make America a lot better place than it is today.